If you were to ask hundreds of thousands of people around the world whether they take magnesium, vitamin D3, or vitamin K2, a lot of hands would go up. But if you asked how many of them actually understand how these three work together or how to take them safely, correctly, and effectively, that number would drop fast. Magnesium, vitamin D3, and vitamin K2 might just be one of the most important supplement combinations you will ever come across. And here is the truth most people do not realize. A huge percentage of the population is deficient in at least one of these nutrients, and many are deficient in all three without knowing it. At the same time, we are seeing heart disease, high blood pressure, diabetes, weak bones, memory loss, and cognitive decline rising everywhere. That is not a coincidence. Science shows that low magnesium and vitamin D levels are strongly linked to higher risks of heart problems, kidney issues, poor blood sugar control, weakened muscles, and even brain-related conditions. Now, let me be very clear. Taking these supplements is not a magic cure, and they do not make you immune to disease. But when used correctly, they can play a powerful role in protecting your heart, your bones, your muscles, and your brain. Here is where things get dangerous. Most people take magnesium, vitamin D3, and K2 the wrong way. Wrong form, wrong dose, wrong timing, or missing one key piece that throws everything off balance. And when that happens, instead of helping, this combo can backfire. We are talking about calcium ending up in the wrong places, irregular heart rhythms, increased arterial stiffness, and in some cases, very serious complications. That is exactly why this video matters. In this video, I am going to walk you through 12 critical things you must know before taking magnesium, vitamin D3, and K2 together. These are things most doctors never explain, labels never warn you about, and most people only learn after something goes wrong. So if you are already taking these supplements, or you're thinking about starting, you need to watch this carefully. Before we get into it, hit the like button, subscribe to the channel to help the video reach more people who will benefit from it. 1. Blood tests are unreliable for detecting magnesium deficiency. Many people, when they hear you say you are considering magnesium supplementation, immediately ask, have you gotten your blood tested? Or did you confirm a magnesium deficiency first? That sounds like smart advice, but this is where a lot of people get into trouble. A standard blood test is not a reliable way to detect magnesium deficiency. Only about 1% of your body's magnesium is found in the blood. The remaining 99% is inside your cells, muscles, bones, and organs. Your body will sacrifice magnesium from these tissues just to keep blood levels looking normal. So what happens is this. Your blood test comes back normal, you are told magnesium is not an issue, and you delay doing anything about it. Meanwhile, the deficiency continues at the cellular level. If you are already dealing with health problems that are caused or worsened by low magnesium, like high blood pressure, heart rhythm issues, muscle cramps, poor sleep, anxiety, blood sugar problems, or chronic fatigue, waiting on a blood test to confirm a deficiency can actually make things worse. The longer the deficiency goes unaddressed, the more strain it puts on your heart, nerves, and metabolism. 2. Vitamin D can deplete magnesium. Now, what do you mean by vitamin D can deplete magnesium? This part confuses a lot of people, and it is one of the most overlooked mistakes. Vitamin D does not work on its own. In fact, magnesium is required to activate vitamin D in the body. Every step that turns vitamin D into its usable active form depends on magnesium. Without enough magnesium, vitamin D just sits there, unused or poorly utilized. Here's the problem. When you take vitamin D, especially in higher doses, your body pulls magnesium from its already limited reserves to process and activate that vitamin D. If your magnesium levels are low to begin with, vitamin D supplementation can push you into a deeper magnesium deficiency. This is why some people start taking vitamin D and suddenly feel worse instead of better. They may experience muscle cramps, anxiety, heart palpitations, poor sleep, headaches, or even fatigue. These are not vitamin D side effects. These are classic signs of magnesium depletion. So taking vitamin D without paying attention to magnesium is like pressing the gas pedal while your engine is running low on oil. It may work for a while, but eventually it causes problems. Don't worry, we will mention how much of each you should take later on. 3. Elemental magnesium amount matters. Elemental magnesium amount matters, and this is where many people get confused. When a bottle says 400 milligrams of magnesium, that does not mean you are getting 400 milligrams of usable magnesium. Magnesium is bound to something like glycinate, citrate, or oxide, and only part of that weight is elemental magnesium, which is what your body actually uses. To check this, turn the bottle around and read the supplement facts. Look for magnesium as elemental and focus on the milligram amount and the percent daily value. That number tells you how much elemental magnesium you are really getting, not the big number on the front label. As a general guideline, adult men typically need about 400 to 420 milligrams per day, while adult women need about 300 to 320 milligrams per day from all sources combined. But this is not one size fits all. Always confirm the right amount for you with your doctor or healthcare provider, especially if you have medical conditions or take medications. 4. Health issues like diabetes, chronic stress, and poor gut health impair nutrient absorption. Health issues like diabetes, chronic stress, and poor gut health can seriously impair how well your body absorbs nutrients, including magnesium, vitamin D3, and K2. Even if you are taking the right supplement and the right dose, your body may not be absorbing it properly. With diabetes or high blood sugar, excess glucose increases mineral loss through urine, so reducing refined carbs and added sugars helps slow that loss. With chronic stress, your body burns through magnesium rapidly, making stress management, proper sleep, and recovery essential. And with poor gut health, inflammation and low stomach acid reduce absorption, so improving digestion with whole foods and addressing gut irritation is key. This is why some people supplement consistently but still remain deficient. Fixing the underlying issue is often just as important as taking the supplement. 5. Adequate magnesium also helps artery calcification. If you think it's only vitamin K2 that helps prevent artery calcification and magnesium doesn't play a role, think again. Magnesium is actually critical for keeping calcium out of your arteries. Without enough magnesium, calcium can deposit in the wrong places, including your blood vessels, which increases the risk of stiffness, high blood pressure, and even heart disease. Magnesium works together with vitamin K2. Magnesium helps move calcium where it belongs, like your bones, while K2 activates proteins that guide calcium into the bones and away from your arteries. So, if you want healthy arteries and strong bones, both magnesium and K2 are essential. Taking one without the other can leave your arteries at risk. 6. Not all magnesium is the same. Not all magnesium is the same, and this is a mistake many people don't realize. Magnesium comes in different forms like citrate, glycinate, oxide, malate, and more, and each has a different effect on your body. Some are better for digestion, some for sleep, some for muscle cramps, and others for constipation. For example, magnesium citrate works well for relieving constipation, while magnesium glycinate is gentler on the stomach and great for sleep and anxiety. Magnesium oxide, on the other hand, has very low absorption and is mostly used as a laxative. 7. Timing matters. Timing matters a lot, especially when you're taking magnesium, vitamin D3, and K2 together. Taking them at the right time can make a big difference in how well your body absorbs and uses them. Vitamin D3 and K2 are fat-soluble, so they are best taken with a meal that contains some fat. This helps your body absorb them efficiently and ensures they work properly in your bones, muscles, and arteries. Magnesium can be taken anytime, but splitting your dose into 2 or 3 smaller servings throughout the day often works best. Taking a full 400 milligrams dose at once, for example, may overwhelm the body and cause side effects like heart palpitations, increased anxiety, digestive discomfort, or trouble sleeping. Spreading the dose helps maintain steady magnesium levels, improves absorption, and reduces these risks. A practical approach could be to take vitamin D3 and K2 with a meal, and magnesium separately morning and evening, or morning, afternoon, and night, depending on your total daily dose and how your body responds. Proper timing ensures you get the full benefit of each supplement safely. 8. Zinc and copper are extremely important in this trio. Zinc and copper are often overlooked, but they are extremely important when taking magnesium, vitamin D3, and K2. Zinc plays a key role in activating enzymes that help your body use magnesium and vitamin D properly. In fact, if you are zinc deficient, correcting a magnesium deficiency can be very difficult. Your body just won't absorb or retain magnesium efficiently. Copper is also critical because high zinc intake can create an imbalance. If you take more than 15 milligrams of zinc per day, it's a good idea to include 1 to 2 milligrams of copper to keep your minerals in balance and prevent issues like weakened immunity or cardiovascular problems. So, when using this supplement trio, paying attention to zinc and copper ensures your body can fully benefit from magnesium, vitamin D3, and K2 without causing new imbalances. 9. Taking D3 without K2 can be harmful. You probably know this, but don't make the mistake of taking vitamin D3 without K2. Vitamin D3 helps your body absorb calcium, but without K2, that calcium can end up in your arteries instead of your bones, increasing the risk of calcification. A good rule of thumb is for every 1,000 IU of D3, take about 10 micrograms of K2 to keep calcium in the right places and protect your heart and bones. If you're wondering how much D3 you should take, the standard RDA of 600 to 800 IU is ridiculously low. For maintenance, 2,000 to 4,000. IU daily is often recommended, and you could increase up to 5,000 IU. Many experts even suggest 5,000 to 10,000 IU daily as a safe maintenance dose. If your blood test shows you are low in vitamin D3, you may need a higher dose for a few weeks, sometimes 10,000 to 20,000 IU, but always with the appropriate K2 ratio and under the guidance of your primary care provider. This ensures you correct deficiencies safely without risking calcium buildup in the wrong places. 10. Kidney health determines safety. Kidney health plays a big role in how safe it is to take magnesium, vitamin D3, and K2. Your kidneys are responsible for filtering excess minerals and maintaining the right balance in your body. If your kidneys are not functioning well, taking high doses of magnesium or vitamin D3 can lead to mineral buildup, which may cause heart rhythm issues, high blood pressure, or other complications. That's why it's important to check your kidney function with your doctor before starting or increasing these supplements, especially if you have diabetes, high blood pressure, or other kidney-related conditions. 11. Medication interactions are common. Medication interactions with magnesium, vitamin D3, and K2 are more common than many people realize. Magnesium can interfere with certain antibiotics, blood pressure medications, and osteoporosis drugs, reducing their effectiveness. Vitamin D3 can affect blood thinners or heart medications, and K2 can also interact with anticoagulants. If you are on any prescription medications, it's crucial to check with your doctor or pharmacist before starting these supplements to avoid unwanted side effects or reduced drug effectiveness. 12. Make sure you are not potassium deficient. Make sure you are not potassium deficient, as this is often overlooked when trying to correct a magnesium deficiency. Potassium deficiency can mimic magnesium deficiency, causing muscle cramps, fatigue, irregular heartbeats, and weakness. Even if you take enough magnesium, low potassium can prevent your body from correcting the deficiency because magnesium and potassium work together in muscles, nerves, and heart function. You don't need potassium supplements. You can get all the potassium you need from food, ideally choices that are low in carbs and sugar, such as avocado, spinach, lettuce, and green bananas. Before increasing your potassium intake, make sure your kidneys are healthy because kidney issues can make high potassium dangerous. Proper potassium levels ensure magnesium supplementation actually works and keeps your muscles, heart, and nerves functioning optimally. So, in a nutshell, magnesium, vitamin D3, and K2 can be a game changer for your health, but only if you take them safely and correctly. Always check with your healthcare provider before adding any new supplement to your routine. If you found this video helpful, like, share, and subscribe to the channel for more informative videos that help you take control of your health.